A lot of times patients will come in asking about their blood pressure. Maybe it's something that they've recently felt like they needed to get checked out or came up in a conversation with someone. What are your thoughts or comments in regards to blood pressure, what we should be looking for, be concerned about?
Blood pressure is a difficult question because it is something that many people are not aware of. And it's really something you can only tell when you actually get your blood pressure taken. Sometimes people are very worried about blood pressure and have really no indication that there is a problem. Some people think, I'm doing just fine, and then all of a sudden get their blood pressure taken and find out that it's quite elevated. The recommendations for blood pressure currently in Canada, particularly when you're getting a regular check, is to do it every single time you come into a doctor's office, just to be thorough in making sure that you're not getting elevations. Blood pressure tends to rise, or you're at risk of having higher blood pressure as you age. There's no real one specific number that we're worried about, so we need to consider this when we're seeing a doctor. I think also you want to consider this in your family history. You know, are there other members in your family who have high blood pressure, and could you be at risk for? There are many other comorbid medical diagnoses that will also put you at risk for high blood pressure. Gender differences can do so. Also, being diagnosed with high blood pressure doesn't necessarily mean that you have to do something about it. There are some minimal, medium, moderate, more significant, urgent, and emergent levels that we're talking about. And they all may require a different approach. Also, we've seen many times that blood pressure can be elevated in necessarily physical issues or pathophysiologic issues, but to the point where it's related to stress or the environment, or it's situational, which you all need to consider when you're coming to see your doctor, and your doctor may want to discuss those with you at the time of presentation.
A lot of the times we get the question of what's a normal blood pressure reading and when to be concerned, whether it's too high or too low. Is there a range? Yes, it's dependent on a lot of factors, but
there is a range, and that range again is probably related to age, gender, function. Sometimes you can get low blood pressures overnight, and sometimes you can get high blood pressures during the day during a particular stressful event. That doesn't necessarily mean you have hypertension per se. It's the average that we see. We want to see it in a resting, normal state where a person is not stressed, having no other issues going on. Those are the things that we would use for as a blood pressure reading and to determine what is a high blood pressure or not. You also want to sometimes look at it from is this a first presentation, a first occurrence in the readings, or is this something that's been long-standing? Again, you may find that your family doctor or whatever physician, healthcare practitioner you have working with you may react differently based on that history that you have.
They always say textbook blood pressure is 120/80. So to the average person, if they were to be concerned on either end of the spectrum, either being really, really high or really, really low, what numbers would they be looking for when they need to come to see the doctor?
I'm going to say 100/60 on the low end and 145/90 on the high end, with a lot of disclaimers at this point saying,
like a consistency of the same number all the time.
If you were a diabetic, those numbers are going to be lower. If you're a little bit older, those numbers might be a little bit higher. If you're on certain medications, you might be lower as well. So all of that comes into play in making that recommendation. You have to be really guarded, and you have to know all of the different possible scenarios to say this is or isn't normal.
Are there symptoms, like a physical symptom that someone might feel if they were on the higher end versus the lower end?
One of that sense of pulsation is a big one. Chest pain may be another one. The sense of headache, that sense of fullness, all might be indications of your blood pressure being high. Lightheadedness, dizziness, feeling like you're going to pass out might be all symptoms of being on the low end.
And do all higher blood pressures or lower blood pressures need to be treated, or are they a watch and wait?
Again, depends a little bit on the cause, the pathophysiology associated with their presence. Not always. That isn't always the case. On the low end, if you end up with some lower numbers, it may be related to hydration and you just may need to take in some fluids. On the higher end, it may be related to stress and we may need to have a discussion or a review of how to de-stress or manage the stress that one is dealing with. That isn't always the case. Yes, sometimes we need to emergently treat that blood pressure. Again, depends on the numbers, the clinical situation.